Hi everybody, Dr. Michael Horowitz with Vancouver Orthotics. Today's foot blog topic is, what is a bunion? Now, one of the most common symptoms people come into our office for treatment is for bunions. And people are always asking, how can I treat my bunions? How can I prevent them? Where do they come from? So first let's talk about what a bunion is. A bunion is where there's a growth, an irritation, an enlargement, some inflammation of the sac, of the bursal sac on the big toe joint. And what happens is there's a thickening of the joint capsule and the tissues around that big toe joint. And over time that can develop, it can thicken, it can become red and irritated. Now, where does this come from? There is a high genetic factor with people that who have bunions. So if your parents, if your mother, if your grandmother had bunions, there's a good chance that you may have them as well. And then there's the question of what type of activities are you involved in and what type of footwear. So if you're wearing a lot of high-heeled shoes, or if you're wearing a lot of narrow type shoes, especially in the toe box area, that can cause irritation, inflammation, and can over time develop a bunion as well. So how do we treat a bunion? Well, first we need to properly diagnose that that's actually what's going on. And the way we do that here at Vancouver Orthotics is we use the latest technology available. We have a 3D foot scan and an electronic gait scan. And we do a variety of other biomechanical orthopedic tests to the feet. What we don't want to do is perform surgery on the big toe if we don't need to. Now, we at our office, we don't do that. That would be the role of a podiatrist. My background education is as a Doctor of Chiropractic. So I have interest in the biomechanics of the spine, but of the feet as well. So feet are made up of 26 bones. Those bones are supposed to be lined up efficiently, and when they are, every step you take, there's a better distribution of force, so that instead of absorbing the ground forces of your weight down on the ground, you are able to disperse that. And there's a few things we do specifically for someone with bunions. We would create an orthotic that might fit into your sport shoes or into your casual shoes or even into your high-heeled shoes. We add a few different things, so we make sure you have proper medial arch support. We may add a metatarsal pad, and we may also create a bunion cutout or offloading component to the orthotic to take pressure off the bunion. And what that does is it allows the bunion to breathe, it allows it to calm down. Over time there will be reduced redness, reduced inflammation, and ultimately that bunion has the ability to recede a certain amount. Now, we don't know how much. Every person, it's different, but that's the way we treat bunions. So my name is Dr. Michael Horowitz. I'm the owner of Vancouver Orthotics. Bunions are a very common symptom that we see here. You can find out more information about us at vancouverorthotics.ca. You can book an appointment online, or you can email us with any questions you may have, because that's why we're here. We're here to help. So have a good day, everybody.